Yeah, the prognosis is varied for different types of meniscal tears. One of the reasons, and I keep on hopefully not belaboring the point about the young patient with the bucket handle tear that we can repair, and the reason that it's important to repair it versus snipping it out is because this structure does have a very important function, as I mentioned earlier, and that is shock transmission. If we take out a big segment of meniscus in a young person and they lose that shock transmission, what ends up happening is rather than the forces of walking and running being dissipated through that meniscus, it gets transmitted right into the shin bone. What that then does is sets this person up for developing arthritis earlier in life. Whereas in our older, our middle-aged and elderly patients that have the meniscus tear, the flap tear that we shave out, just by definition of that tear occurring, some of the function of the meniscus has already been lost, and by snipping it out, we're alleviating some of the mechanical type symptoms, but we're not totally restoring the function of the meniscus. And again, there's going to be some loss of the shock absorbing properties and thus an increased risk of developing arthritis later in life.